The single most important thing that you do is use sun protection every day, all year round. And newer sun protection is really much more advanced than in years past. Now we look for both UVA and UVB protection. Look for either the word photostable or broad spectrum on the labeling. And the higher the SPF, the better, to a point. So I usually recommend an SPF of 30 or higher. It also helps to use antioxidants in the skin, and there are some ingredients such as retinols that have a lot of clinical data behind them that are very effective in helping your skin rejuvenate itself naturally over time. I think as part of any general skincare program to help your skin look its best, it's important to do a few different things. One is to cleanse on a regular basis, so cleanse at least at night before you go to bed. In the morning you can wash again or else just rinse with water. Exfoliating is very helpful, but one problem people have is that they over-exfoliate. And so that can irritate the skin and really take off that outer layer of skin cells that is protective to your skin, so you don't want to completely remove it. It's also important to moisturize if your skin is dry. If your skin's very oily, you don't really have to moisturize. And then using certain ingredients like niacinamide, vitamin C, other antioxidants, vitamin B3 is very helpful. And I like caffeine as well as a topical ingredient for the skin. Caffeine may have some sun protective properties, although you can't use it as a sunscreen, and drinking it is not the same as applying it to your skin. The other thing it can do is it can be anti-irritant and very soothing, so it helps you tolerate other ingredients better. If you over-exfoliate your skin, what you'll notice is when you apply a product afterwards, even if it's a rich emollient moisturizer, your skin may sting or burn. And that means you've really stripped away the outer layers. Now, we used to think that dead outer layer of skin, which is called the stratum corneum, that was just extra skin that we need to get rid of. But actually, that layer provides sun protection, it helps with water balance, and it has a lot of important functions in your skin. So even though it's not a living layer of skin in and of itself, we don't want it to overdevelop because then it can look a little scaly and make your skin look dull, but we don't want to strip it away entirely either. So if you have sensitive skin, look for a gentler, smaller bead, finer exfoliant product, and don't do it every day. Maybe once a week is enough. If you're very acne prone, then you can use a little bit more of an aggressive exfoliator. But just as we had with toothbrushes, those hard bristled toothbrushes, they just wash away the enamel on your skin, but they don't make your teeth any healthier. Over exfoliating your face will get rid of that outer layer of skin, but you're not any cleaner and you're not any better off. Our skin is continually evolving, and one thing about the skin is that while it does regenerate, there is also memory. So from your first sun exposure, you do have some damage to the skin. The sun is really quite toxic to the skin, even though the sun has some vital values in our lives. For the skin, it's really not a very positive experience, and that damage does accumulate over time. In people who smoke, that can have a powerful effect over time, and that can be cumulative. But the good news is that when you start to take care of your skin, no matter how much damage has been done, it does have the ability to repair, at least to some extent. And so there's so much we can do to help keep that skin looking more beautiful and healthier over time. If you have multiple sunburns or cumulative sun damage over time, that will ultimately, depending on your genetics, sooner or later evolve into damage that we may see on the surface, either in the form of skin cancer or other changes such as brown spots and broken blood vessels and fine lines and wrinkles. So the damage that happens over time is cumulative. And one thing my patients tell me all the time, they walk in at a certain age, it's different for everybody, but usually in their 40s and above, and they say, one day my skin just fell apart. And it seems like, I think of it as if you have a paper towel and you hold it under water and it seems to hold really well. You keep putting stuff on it and it's holding, and then all of a sudden it comes apart. Your skin is kind of that way too. It has a threshold and it's different for everybody. Part of that is dependent on genetics, and at some point it will automatically show. And so some of it is gradual and it's under the surface. And our job as dermatologists is really to read the skin, to be able to gauge it and to guide our patients in the treatments that they can do, in how much sun protection they need, and how to take the best care of their skin so that it can stay as healthy as possible and remain looking young and vibrant over time. that if you wake up and your skin is very dry, that means that you have to hydrate a little bit better at night. So if you wake up and you're dry, use a richer, creamier moisturizer before bed. If you wake up in the morning and you're more oily, then you can skip your morning moisturizer or use a lighter lotion if you need. We tend to lose more water from our skin at night, and we tend to make more oils throughout the day. So some people notice that in the morning they wake up normal to dry, but by midday they have oil spots and they kind of feel greasy in their skin, and then they make the mistake of going home and over exfoliating, scrubbing, using drying products, and then they create this backward cycle. So if you feel like you're very oily in the middle of the day, look for a mattifying product. This may contain a little bit of a salicylic acid or other ingredient that can absorb some of that oil and take away that sheen on your face. A blotting powder or pad can be good, or even a translucent finishing powder can help make your skin look more even and less oily or greasy. So you kind of have to think a step ahead in where your skin is. And if you wake up dry, moisturize better at night. If you're oily throughout the day, don't go and be too aggressive before bed because you might create a negative cycle. Well, the sun does a lot of things that are positive. We enjoy the light and the warmth, and it does give us a sense of balance and well-being. So I never tell my patients not to go outdoors and have a good time. It's important to be active and to be outside in daylight hours. However, while we're doing all that, it's really important to protect our skin from the harmful ultraviolet rays. One thing that patients say, and some doctors say too, is that you need the sun for vitamin D. That's a little bit of a myth. We've come so far in our society, in our culture, and our technology that we can make vitamin D supplements that are virtually the same as what your skin makes from ultraviolet radiation. So I typically recommend vitamin D3, which is a bioavailable active form of vitamin D in the form of either a supplement or from foods, which is much better, much safer than getting it from the sun. I think one important point is that when you change your seasons, if you live in a place that has seasonality, that it's important to use different products with different seasons. So oftentimes I tell my patients, when you put away your summer clothing, put away your summer products. So in the summer when there's more humidity in the air and we make more natural moisturizers because we sweat a little bit more, and that also provides some moisture to our skin, you can use a lighter lotion on your skin and just get away with that just fine. But in the winter when it's much drier and we lose more water because water is constantly being pulled out of our skin from the dry air, especially when there's lots of change in climate from the cold, dry wind outside to the hot, dry heat inside, you need to use a richer, creamier, more emollient moisture. So look for something in a jar. And the most important time to apply it is right after a bath or shower when your skin is most hydrated. So don't take too hot or too long a shower. We take 10 to 15 minutes. And then pat your skin dry so it's still damp, and that's when you apply the moisturizer. The really good news is that newer formulations of moisturizing products are not sticky and greasy and don't make you feel the way the old products did. They're much more cosmetically elegant and they sink in much more quickly. And so they are much more fun to use than they used to be. One thing that makes the skin so wonderful is that there is a lot of communication backwards and forwards amongst the different layers. So even that dead outer skin layer that doesn't have any life to it, it's just sitting there waiting to slough off, when that layer is intact and healthy, basically, what happens is that creates an environment that feeds back to the layer behind it, which feeds back to the layer behind it, and that stimulates different elements in the skin to behave a certain way that helps in repair and rejuvenation. So our skin has a natural, innate ability to help itself. What we have to do, what our job, is to provide it with ingredients and an environment that will maximize that ability for the skin to help itself look its best and to turn over as appropriately as possible. And what this does is it helps the skin not only stay young looking, but actually be more healthy altogether. And if there are areas of damage in the skin, by creating that healthy barrier, that healthy environment, the skin will possibly even prevent those skin cancers from forming over time. So this is not just aesthetic. Oftentimes it can have a true medical benefit.